why it's important, and how we should clean them. Okay. All right. So what is point of use instrument care? So point of use instrument care refers to the process: wiping down your instruments, flushing instrument lumens with sterile water when the instrument is passed from the surgical field back to the, to the table. So basically, if the doctor puts the instrument down and you see he's not using it at that second, take a lap with the sterile water and just clean it. If it's dirty scissors, just swish it in the water. Give it a quick swish, and before he needs it again. Point of use instrument care best practice. So wipe your instruments, clean them with sterile water, remove the blood and debris from the surface during the case to assure the instrument is clean when passing into the field. Irrigate your lumens periodically because your suction clogs, right? So every time, Fran, my suction's not working, well, that's because the lumens aren't being cleaned. So just, or even just dip the water in there, take the little bowl, have it suck through the water. Soak instruments that are difficult to clean. So if they take a rich and they're not using it anymore, just put it in the water. You know what I mean? Let it hang out there for a little bit, give it a quick swish, wash it with your lap. Oh man. Sorry. That's what you a little overzealous. At the end of the case, make sure all instruments are clean when you restring them and you put them back into the boat. We've been having issues where the boats are coming up, they have bone chips, blood inside the scissor piece, like in the center of the scissor. They're just not being clean, and I don't know what the issue is, but just make sure you clean. I've come back from lunch and my whole mayo was full of blood, and I had to change the towel. Yes, I know it's a bit much, but you can't work in a dirty spot. So you got to try to decrease infection, because that plays a role. Like if you're passing back and forth using a dirty instrument the whole case, it's kind of gross. All right, and then at the end of the case, make sure you spray with the enzymatic spray. All right. Good. Yep. Why is point of use instrument care necessary? Decrease the number of microorganisms on the surface of the instrument, prevent biofilm, decrease the risk of surgical site infections, support the efficiency of the decontamination process, and maintain good working order of the instruments, because if you have a scissor that's filthy, he's not going to be able to cut with it. What should we clean with and why? All instruments should be cleaned with sterile water during the case to prevent instrument corrosion of pitting. So if you use saline, the instruments can pit. So that's why you want to use the water. And then at the end of the case, the enzymatic spray. Okay? All right. Instruments. Think about the instruments the surgical team is using. So the instruments that he's using the most is the ones that you want to keep clean. Like I said, if there's a rich, if there's a, whatever, just throw it in the water, let it hang out there. You don't have to have it right away. It can just sit in there. If you're using the Andrews and you switch to the others, the micro suctions, what? Fraser, thank you. Just let it soak in there. You don't have to just let it sit in there until he's ready to use it. But make sure you flush the inside of that so that it gets clean. Any other instruments that you guys think should be cleaned during a case? All right. Next. All right. So now we're gonna take some of these and I'm just gonna show you. So see this? Yeah.